Non-small cell lung cancer in many respects has been a disease that has been at the forefront of sort of molecular medicine, subdividing the groups of patients that have specific driver mutations and then devising therapies that are specific for those driver mutations. The first one that we had, of course, were mutations in the epidermal growth factor receptor, EGFR, and that was known to be a major driver in lung cancer. There are several other drivers that over time have been identified that potentially can be essentially what leads to the development of lung cancer. The approvals of other targeted therapies, therapies directed against ALK, ROS1, BRAF, and most recently NTRK, are sort of a furthering of that story of subdividing the group of patients. MET is an oncogene that has been evaluated for quite a while in many histologies, including non-small cell lung cancer. And traditionally, when investigators looked at MET as a driver, what they largely looked at was gene amplification. So, of course, physicians who take care of all sorts of malignancies are familiar with the role of amplification. Being at UCLA, the amplification of the HER2 gene is very near and dear to our hearts, of course, as a driver in lung cancer. There are a small population of patients who do have an amplification of the MET gene, and there were reports several years ago that drugs that effectively target MET could potentially be effective approaches there. But more recently, there has been the recognition that a significant chunk of patients with lung cancer have a mutation. It's actually a host of different mutations that lead to sort of the same consequence, which is skipping of MET exon 14 in the eventual product of MET. This leads to decreased ability for MET to be destroyed, and that has more recently been recognized as an important driver mutation in maybe 3 to 4% of patients with non-small cell lung cancer. The role of gene amplification is near and dear to our heart at UCLA. My division chair, Dennis Slayman, of course, was a driver in characterizing the HER2 new gene. And that, of course, is a gene where you see amplification as really a driver of malignancy, in that instance, breast cancer. Exon 14 skipping in MET is somewhat different than most of our mutations, and as a result, it has not been routinely tested in the way that EGFR or BRAF have been tested. In general, what one sees in these mutations are several different mutations, and what these mutations do is they lead to the corresponding part of the protein that would correspond to MET exon 14 not being part of the eventual protein. Well, of course, in general, we're not used to the idea that loss of a significant part of the protein would lead to sort of a driver mutation. But in this case, the part of the protein that is lost is important in destruction of MET. So on a functional level, the protein doesn't get destroyed, and that is at least proposed as why this can be a driver in the setting of this MET exon 14 skipping.